All right.
Well, hello, I'm here with Dr. Aznavour again. And Dr. Aznavour, we have talked about missing teeth. And I would like you to talk now about what are the methods of replacing them. I know there are many methods out there, and why don't you shed some light on that? What are some of the advantages are? And why don't you also tell the listeners of where your office is and a little bit more exact?
Sure. My name is Dr. Sarkis Aznavour, and I have an office on Lyons Avenue in Newhall, California, which is about a quarter mile from the 5 freeway in Southern California. And basically, there's a few ways we could replace teeth these days. We've got implants, we've got bridges, and we've got partial dentures. These are the 3 most common ways of replacing teeth. And let me go over the advantage and disadvantage of each one. For example, an implant is usually the most popular in the last 5 years. It's come along a very long way. In terms of success rates are very high, in the high 90 percentile. The pros of an implant, for example, is that you don't have to grind on adjacent teeth. You place a titanium rod in the gum and you let that heal for about 4 to 6 months, depending on how good your bone is, depending on which area of the mouth you're replacing the implant. And after 4 to 6 months, you place a restoration such as a crown. You're not touching any adjacent teeth. The disadvantage of an implant, for example, is that you have to go through surgery. You're going to have to go some time without a tooth in that area. And cost. It's the most expensive way to go. And most insurances will not cover it. Your second option is a fixed bridge. Now, what is a bridge? Let's say you have a tooth missing and you have 2 adjacent teeth on either side of that missing space. What you do with a bridge is you usually have to grind those 2 good teeth to place crowns on them, and there's a fake crown attached to that 2 crowns that you placed. Now, what's the advantage of a bridge, let's say? Well, first of all, cost. Usually it's about half the price of an implant. Most insurances will cover that. The disadvantage is cleaning bridges. It's much harder to clean, although it is cleanable. And you are grinding down on adjacent teeth. Now, in terms of lifespan, how long does each one last? Well, an implant usually can last for the rest of your life. Of course, that limits to, health history, smoking, all those can affect the restoration or the prognosis of a restoration. Now, of course, there's the last one, which is a fixed partial denture. A fixed partial denture, the advantage of that is if you're a removable partial denture, sorry about that. The advantage and disadvantage of that is, advantage is if you're missing multiple teeth, you can replace that. Now, a partial is something that is removable in your mouth. You have to remove it, clean it, and place it. Every day you have to do that. In addition, the disadvantage is that food can get trapped. Aesthetically, it doesn't look as good. You've got metal showing sometimes. And your biting force isn't going to be as great compared to an implant or a bridge. The advantage is cost. Cost and being able to replace multiple teeth rather than 1 tooth. And that's one of the advantages of a removable partial denture. And of course, cost. It's usually the cheapest way to go. It's about half the price of a bridge. So an implant being the most expensive, then a bridge, then the removable partial denture. I mean, for example, my recommendation usually, it depends on the patient and the case. So each person is different, each person's biting habits are different, and each person's hygiene is different. So we have to determine which restoration is best according to a number of factors. You can't just say one is the best.
I understand, obviously. For instance, like since you mentioned the cost of a partial, let me ask you. So let's just say a person says, I really want 1 or 2 or more implants, but right now is not the time. I just don't have the money. Maybe even I don't have the time physically. I'm going on a vacation trip or something like that. So is it possible to put in a partial temporarily, and then put in an implant a year or two later when the money is saved up, or half a year later? And or is there even something else which a person can put in temporarily while he is, so to say, waiting to get the implant due to perhaps cost?
Yeah, that is a very good possibility, because it's better to have at least some teeth there to distribute the forces of bite or occlusion, as we call it. It's better to have something there than nothing at all. The only disadvantage of delaying...
Right? Not look all that
What's
ugly.
that?
Not look all that ugly.
No, it's better than missing teeth, let me put it that way.
Right.
At least you have something there, maybe a little metal show, but there's ways around that one too. But in terms of replacing teeth, if you delay placing an implant, the biggest risk is, of course, losing bone. The other advantage of placing an implant is the implant helps you keep the bone in that area, because there's always a constant force. So whenever the tooth is gone, your bone slowly deteriorates, it moves away. Even if you have a partial there, the bone can always move away. So although there is a disadvantage of delaying implant placement, that is always an option for the patient to put a partial and then place the implant. We even do that when patients get the implant. They don't want to go with a front tooth missing, for example, let's say. So we make them what's called a stay plate, which is like a temporary partial. It's a piece of plastic with no metal, and the patient can wear it as a temporary. It's not made for eating with. It's mostly for cosmetic reasons.
I got that. I think you touched on something very important, which is the tooth loss, and I think we might want to just a little bit more talk about that for just a second. To most people, tooth loss, well, it might not mean a lot, but why don't you explain a little bit, how a tooth loss kind of like makes your face shrinking and looking like a dried out tomato eventually, and makes you looking really old. Now, it might not do that. You might not get enough tooth loss with one tooth here and one tooth there, but if you have several teeth missing, for sure that's happening, right? And even with one or two teeth, it will, again, deform the look, and actually makes you look old, makes you look, like those caved-in old people. They look like that because they had dentures for many years. Isn't that the truth?
That's very true. That's because the tooth supports the face as well. Okay, the tooth puts pressure on the lips to push it out, so you don't get the wrinkles. I get this a lot with people with dentures. They haven't had dentures for a number of years, or they've had old dentures, which has caused their face to collapse. Because they've worn it for so long and the denture has worn out for so much over the period of time. And we make them a new denture, and now their face looks more full. And they're like, wow, my wrinkles are gone. That's because the denture is supporting the lip properly now. And that's one of the reasons why it's important to try and keep your teeth by flossing, cleaning, your regular checkups, very important. And that, will cause, if you're missing a tooth, not only will it affect your bite, your chewing, but it can affect aesthetics. Very important, because it will cause your cheeks to collapse. It can cause wrinkles. Those are all very, very good points and important points in terms of cosmetic and function.
Wow. So basically, flossing your teeth, brushing your teeth, getting your cleaning, getting, and if something happens to a tooth, do what the dentist does. Simply, basically, is the best and the cheapest cosmetic surgeon you can get.
Yeah, that's because we all focus on preventive. There's nothing better than your own tooth, And if you come in for preventive services, there's always less of a risk of losing that tooth. And that's one of the things we focus on as dentists is prevention. Fluoride toothpaste, flossing, regular checkups. Those are very, very important in terms of keeping your teeth. And that's what we stress in terms of dentistry. That's the most important. It's not the implant or the veneer, or these are all later technologies. Nothing's better than your own tooth. Let me put it that way.
Well, all right. That's it for today. People can visit you on the website shown below here, or call you at the phone number below. Goodbye.
All right. Thank you.